Okay, so today I am going to talk about water infrastructure in Lagos and water flows in Lagos with a particular focus on Makoko. And given the recent developments in Makoko, the recent demolitions that have affected almost 8,000 households, we have a special guest today that will talk about the demolitions and what's been going on. Mr. Idowu Gowon, as we've already mentioned. So I will start with introducing Makoko and the research context, and then Gowon will talk about the demolitions, after which I'll go into urban debates that are happening around urbanism in Lagos, and then finally talk about water in Lagos, the production, distribution, and consumption of drinking water and water infrastructures. And then finally, we'll have hopefully a rich discussion at the end. This is an aerial view of Makoko. It's a picture that most of you might have seen in some variation. There's a lot of visual narratives and visual imagery circulating through media about Makoko. And in order to show a sort of different side, I want to start this presentation with pictures that were taken by Makoko residents to actually show how they perceive their neighborhood and how Makoko is happening and is existing beyond the imagery that we know and see usually. So this one is my absolute favorite. I think it could win prizes, to be honest, and it's a tailoring workshop on the land side of Makoko. Here you have a hairdresser. This is cooking happening. Another hairdressing situation. And these three are boaters who work in transport, so water transport, and they sort of transport people from one part of Makoko to another part of Makoko by using the boats and charging them for it. They've been directly affected by the demolitions, of course, because it's affected a large part of the waterside community. So, introducing Makoko, we can say that it's a fishing village that has existed for around 200 years from before the 19th century. It now has around 250,000 inhabitants, which is sometimes contested, the number, because the official census doesn't go into Makoko. But we do have mapping initiatives that can approximate a number, which is the 250,000 that I'm using here. It's a neighborhood that is on prime land, both land and water, and the government seeks to evict the residents since decades to develop the land for profit. We know that the government and the private firm FBT Coral have been collaborating, or actually the water part has been sold to FBT Coral, which is already filling parts of it with sand. Makoko has resisted eviction efforts through community mobilization and legal action for quite some time, especially following the 2012 demolition by the Lagos state government, which then resulted in a memorandum of understanding in 2014, and a lot of attention of international actors. Now, on Christmas, actually the 23rd, one day before, 23rd of December, renewed demolitions have happened, and they've lasted for around 3 weeks. This is Makoko within Lagos. So you can see the arteries of Lagos and Makoko in the midst of it, next to water and land. It's located in the government area of Yaba and its neighboring Iwaya, which is also part of Yaba. It's built on land and lagoon, which you can see here, and there's a power line, high voltage power line running through, which is the subject of contestation of housing around. So the demolitions that have mainly happened around this power line, but more than the MOU that was provisioning that houses should not be built in a perimeter of 100 meters. The demolitions have now destroyed houses up to 522 meters from the power line, which broke the MOU and was reported in media outlets. The city and especially Makoko as an example of Lagos can be understood through its water veins and arteries. And so how water is produced, distributed, and consumed speaks to wider socio-spatial processes that are going on. We know that post-colonial water infrastructure is closely linked to colonial health governance, and Makoko is no exception, as it was built outside the zones where colonial infrastructure was built. So residents, as mentioned, live on two sides, land and lagoon in Makoko, and there are socio-spatial differences depending on where you live and how many rights you have to actually access the city. So people who live on the lagoon are mainly Egun from the Egun ethnic group, who are mostly immigrants or from other parts of Nigeria. And there's mainly Yoruba, but also Hausa ethnic group living on land. There's a continuation of marginalization that has its roots in the colonial government and that finds expression in a lack of infrastructure of low-income residents today, like in Makoko, and a disproportionate exposure to health risk. And demolitions are by far the most devastating health risk in the last year, but also high rates of waterborne disease and other communicable and non-communicable diseases. This is a timeline of Makoko and the major events that have happened since its beginning or since we've started sort of recording and mapping. So as mentioned, it starts in 1900. From before, we have not really written knowledge of it, but then after it starts popping up in different maps and also infrastructural development starts happening, where the Makoko Road is a major development that led to actually improvement in public health because hospitals could be reached faster. But then we also have the forced evictions that are happening first in 2005. And then 2012, the MOU in 2014, that was quite an important event, and now the most recent demolitions. We can go back to this or you can have a look later, but I'd like to now go into the recent demolitions. But before we do, I would like to show some of the pictures that I took during my PhD research when Gowon and I were taking these boats and going through Makoko and some of the really nice stilted housing. So on the right was a house that is an orphanage or was supposed to be an orphanage, and it looked really, really wonderful. And in the middle, we were just sailing past, and to the left is Gowon smiling at the camera. This is what it looks like now after the demolitions. It's just a small part of the demolitions, but it shows the extent of the destruction and people trying to collect what they can before things are burned. So now I would like to give a trigger warning. I'm going to show a video of the aftermath of the demolition. There's no human suffering, but you can see the destruction. So if you don't want to see this, then maybe you can turn the screen off. So now I'd like to invite Gowon to give us more about the context of what's been happening with the demolitions and how it's played out in the last few weeks. Gowon, can you hear us?
Yes, I can hear you.
Perfect. So Gowon, can you talk a little bit about the demolitions and what's been happening?
Good afternoon, everybody. My name is Gowon Idowu. As it is now, the demolition started from 23rd December to December 23rd January. That's how it started, and that's how it stopped. They started when they came to our community. Once they called on our ballets that demolition, they want to do demolition. So we say no. And that MOU that are being given to them as the ballets and the STB choral that caused this. When they came and they said that they want to take 100 meters away from power line, we agree on that. When they started, they are above that level to 520 meters. And then we have no option. All those things is embarrassing. And then one day, they almost to 300 meters. And the governor said as he's coming to see what is happening. And he came. He stopped at the Sanfield area, the one that I showed you the other time. They stayed there. After then, they said they are coming. Nothing again. They started again. And demolition continued to 520 meters. And some of our people died. Some women, they are rushing to the hospital away. One of what is make me I'm not getting myself is when their demolition is going, the tear gas they are using to send our people away. One of women that want to take labor, and everybody was looking for their life to be saved. Nobody can attend to the woman again. And that woman delivered twins, and the baby died, and the woman died also. And the three of women, children, four of them died during the process because of that tear gas is too much. Nobody be able to see what is going to happen again. You have to run to save your life. That's how the thing happened on the 23rd of January. And the way that they crowded from everywhere, and my friend Amaka, everybody, and they sent to the government, every NGOs from abroad, everything. They heard the cries of Makoko people. That's how they stopped this demolition. And they are telling us now they are coming to the place that remains small part of the waterfront. It's not more than 100 meters. It's not more than 100 meters. They remain that place because everybody in Makoko, majority in Makoko, is on water. The houses that demolished is almost 8,000 houses. because many people, some people in our area here, there will be about 20 people can sleep in one house. Then 7 can be inside one room. That's why the population and the houses they are building just shanty, four corners, and that's how we are building house. That's how it is. And recently, I'm talking to you now. Our people are in the government at Ikeja now, protesting that you should leave this place for us. If you see a sea of hope, they want to the ownership. They want to give us. They should give us that. Now we can be staying here. That's how the thing happened.
Thank you very much, Gowon, for the overview. And as I've said before, I'm really sorry this is happening, and it's good that you were able to come and give the context within this talk. So Gowon will stay on, and we will have a question and answering later. And now I'll go on with the rest of the presentation, which looks at water in Lagos. So thank you, Gowon. Okay, so you can see the presentation again, right?
Yes, please.
Yes, thank you, Victor. I'd like to go into urban debates in Lagos, the discourses and the literature that exists around things like evictions, but also urbanism, how it plays out. So Olajide and Lawanson, Professor Lawanson here, they've written a paper in which they coined the term the neoliberal urban paradox, where state actors actively engage in the privatization of land, services, and infrastructures at the expense of informalized low-income residents. So here, the state and not private actors is an active agent in the hollowing out of the state, which is contrary to what we often find in the literature about hollowing out the welfare state and the hollowing out of the state by private actors. So in this vein, the very category of informality serves as the main justification of evicting previous dwellers from prime land to make way for housing development aimed at higher earning Lagosians. Lindsay Sawyer in 2016 showed that the traditional government or royal families and state government often collude in some cases to evict and profit from the displacement of so-called informal settlements. The narratives that are used to describe informalized dwellers often portray them as the root problem rather than part of the solution, as Adegbeye has shown. I'm also showing that the narratives that are used to describe they often leave out the administrative neglect that precedes environmental problems, for example, or other problems of infrastructure and habitation. Olajide also shows that the binary category of formal and informal that was in the first place introduced during British colonial rule has always served as a racialized tool of socio-spatial control and displacement. At the same time, fragmented urban governance finds its origin as well in British colonial rule and practices of indirect governance, which co-opted traditional governance structures and thereby delegitimized them. So now a lot of fractures along the customary rule and the formal rules, they find their origin in this sort of splintering of governance structures during colonial rule in the first place. There is also a lack of interface between government planning and residents, where planning is top-down and autocratic, and many residents only interact with the planning agencies during enforcement or demolition. Public documents in general are not very well accessible, such as the master plans or the model city plans. This is just an overview over the methodology. Just to quickly say, for my doctoral research, I did mostly semi-narrative interviews and mainly with health practitioners, water stakeholders, and government officials. I also did a autophotography and participatory photography and a photo walk, as well as observation and walkarounds and a document analysis. What is the argument? The argument is that there exists a post-colonial water health nexus that actively contributes to urban health inequalities. So post-colonial governmentality is very much ingrained in urban health agendas and defines hydrosocial relationships in Makoko. What does this mean? This means that the possibilities of the dwellers to realize their right to healthy environments are actively obstructed by the post-colonial production of sociopolitical and ecological spaces today. Now, this is a little bit abstract, but I'm hoping it will become clear as I go into the details of hydrosocial spaces. Charisma AC has done a lot of work on water institutions and sort of water inequalities in Lagos. And she writes, the colonial preoccupation with sanitation led to the division of the city into essentially two parts. The municipality proper, essentially the European area, where planning and basic city services were provided, and the so-called native area, disparaged as unsanitary and primitive, although these areas were also urban districts that were integrated with the city. She then says, ultimately, redressing past racial injustice and its manifestation as present spatial injustice means formalizing the rights of poor people, an act necessarily predicated on the state's recognition of the universal right to urban services. Here is a graph or a figure of Charisma AC that she's done in 2019 about the hybrid institutional actors. I'm not going to go into the details of it, but basically we can see that this binary understanding of formal and informal, it's more of a hybrid form of institutions where you can't really detangle what is formal, what is informal, because formal and informal are very much internally related. So if you have a water source, that you might buy from an informal dweller or informal production site, it still might have gone through formal regulation channels or delivery channels. So what does this mean for water infrastructure in Lagos in the sort of nitty-gritty? Here on the left, we see a water truck, which was parking in front of where I was living in Surulere and filling up the tank of a private household. Now, this is one part of water delivery, but most people do not get their water that way. And with most people, I mean the urban majority that lives in informalized settlements or low-income communities. That is the case because the Lagos Water Corporation production capacity lies at 210 million gallons per day in 2024. Now, this is government data from the Lagos Water Corporation itself. The water need, however, is almost 4 times as much. So the water need is 724 million gallons of water per day in Lagos. So the gap is filled by private enterprises or waterpreneurs, as they're often called. That is because the colonial urban planning agencies, they did not have the general indigenous population in mind when introducing centralized water networks. And the water networks, as AC has also described before, are exclusively found in those parts of Lagos where Europeans, returned slaves from Sierra Leone and Brazil, and British-educated Nigerians lived. So, for example, Lagos Island, Ikoyi, parts of Ikeja, and Ebute Metta. that water pipes were constructed there to serve households and compounds. This is a timeline of public water infrastructure and when it was built. So it started with the completion of the Iju waterworks, and then the Iju waterworks were slowly expanded, upgraded to 6 million gallons per day, and then to 35 million gallons, to 45 million gallons, and now at 45 million gallons, but I think it's being rehabilitated again today, and a lot of other waterworks and mini and macro waterworks were added to this as well. The gap of more than 500 million gallons per day is provided by a private water system that consists of production, distribution, and consumption spheres. So what this does is that it leads to an extremely high and unequal cost of water. And in Makoko, we've seen that sometimes this means that a third of household income is spent on buying water, sachet water or bottled water, drinking water, in a city where you have archipelagos of affluence, as Bakers called it, and then the in-betweens, which are the vast majority of people who get their water through these private water systems or from waterpreneurs. The water flows that develop through this private system are extremely gendered, as the water business and the profit is male dominated. So people at the head of the water business are almost exclusively men, and there's a lot of profit to be made. Just yesterday, I saw that one of the richest people in Nigeria and on earth, I forgot his name, but he's of Lebanese descent, owns various water companies. Contrary to this, fetching water and sort of the caring element of bringing water for the family is the task of mostly children, but also women and sometimes young men. Government representatives, when it comes to water, only engage with Makoko residents and low-income communities to make promises whenever they need votes for elections. But after the elections, the promises remain mostly unfulfilled. The current demolitions also need to be understood in the light of the upcoming elections next year. So here we see an industrial module in a water production facility in Iwaya. So in Iwaya, we have most water production companies that deliver to Makoko. So Iwaya is just next to Makoko and has a good drinking water quality. We see a tank, which is a four-tiered chemical sandbed, the first tank, which has a four-tiered chemical sandbed for the general water filtering. It then goes into the next tank, where you add resin to soften the water and a chemical treatment product called Actolite to boost the pH value of the water, and then with an additional sandbed for another filtering stage. Then the final tank has a carbon bed to filter and improve the taste of water. And the chemicals used here, they come from outside, mostly Victoria Island, but also as far as Oshodi. Once this stage is completed, the water will be channeled into the semi-treated or treated tank. It depends on the water producer which treatment stages they follow. So here's the semi-treated water tank that in this picture was used as a raw water tank for aeration. So you can see, it's not a very good picture, unfortunately, but at the top you can see a shower. So this serves as aeration to add oxygen to the water. Here you have another filtering stage with a micro wool and UV light filter. And then finally, it goes into the water sachets through these industrial sachet machines. They're quite expensive, so not everybody can afford to buy one. And in this room, you have people monitoring the machine and sort of stacking the water. These water sachets, so this was the first production step of the water hydrosocial cycle, or the water cycle in Makoko and Iwaya. So these water sachets, they're then distributed wholesale, either via agents who find distributors or directly to distributors. And then from these distributors that buy wholesale and make a profit from it, water sellers and vendors, they buy smaller amounts and sell into the more remote areas of Makoko. Now, what that means is that, for example, sellers who are almost exclusively women, they have maybe one bag with 20 sachets in it and sell it on a daily basis. The many steps in between mean that those who are socio-spatially most disadvantaged will pay the highest price for water. So those who are further removed will pay more, because those who are part of the network, their water price per gallon is much, much lower than the water price per sachet. There exists a NAFDAC registration process, which you can see there is a NAFDAC registration number usually on the sachets to be able to trace the quality monitoring. The minimum cost of water for drinking and non-drinking in 2022 was 13,110 naira. Now, if you look at the minimum wage at the time in 2022, it was 30,000 naira, so 1/3 almost of the minimum wage is the minimum cost of water. Now the minimum wage stands at 70,000 naira, which is still, I mean, it's not a relation that is fair or just. And at the time, 450 naira was €1, and probably 500 naira was £1. Now, let's get to community health. We see here is a water pipe that runs along the houses and runs through rubbish and contaminated water to bring water to the further parts or remote parts of the community. Now, this is not drinking water, although if you really have to calculate the money, some people will use it as drinking water, but that is really not the norm. So this is more used for washing and cleaning. Now, the water pipes run through the lagoon water, which we've just seen. And if the pipes are damaged, because boats sometimes, when they run between houses, boats sometimes go over the pipes and can break them and crack them open. So when they're damaged, of course, the drinking water is contaminated. And if you ingest contaminated water, of course, it will lead to all kinds of waterborne diseases. Now, children sometimes also swim in the lagoon or drink untreated water, and they will fall sick after doing so. There is individualized quality control and monitoring. So the quality control is mostly individual responsibility, meaning that one, it's by reputation. If you know that a water producer does not have good quality water, you will tell others. And the other is that producers and residents will send their water samples to a nearby lab, if they can afford to, for quality analysis of the borehole water. Let's come to the TMPs. So this is basically Gowon's work and his colleagues' work. So whenever people do fall sick with waterborne diseases, they see a traditional medicine practitioner, and they will need to pay the TMP as well. So traditional medicine practitioner is the abbreviation is TMP. They are the primary healthcare infrastructure in places where you don't have state-sponsored infrastructure. So on the water side, there was a lack of primary healthcare centers. There's better infrastructure on the land side, and you can also get faster to a hospital. So that means that TMPs operate on the water side, but also on the land side. And very importantly, they collaborate with formal hospitals and pharmacies. So the TMPs that I've interviewed, they received medical training organized by Arctic Infrastructure, which is a Lagos-based urban planning agency, in collaboration with a Swiss NGO, with the aim of receiving formal government certificates to grant recognition of TMP's work. So TMPs, although in the name it says traditional medicine practitioner, they're officially recognized through these certificates by the government and are able to collaborate with the formal system and issuing, how do you call it, issuing prescriptions that in some pharmacies, if they know the TMP, they will give you the medication. There exists also a referral system that enables residents to seek healthcare in hospitals in other parts of Lagos, where TMPs can send residents when they know that they cannot treat them with their existing infrastructure in Makoko, then they send them to hospitals. And they also often follow up. So they have a lot of social work tasks that they also fulfill in terms of following up and caring for community members. They also represent a third way of bridging formal and informal divides that are constructed in the literature. So to sum up, the research findings sort of can be described as a form of hydropolitan urbanization that feeds into the hydrosocial cycle and different determinants of health. Now, I'm not going to go into this draft a lot. We can talk about it if you're interested, but basically, these three spheres are the social determinants of health, political determinants of health, and then something which I've named epistemic determinants of health, where existing knowledge around healthy urban areas and health in general of indigenous communities or low-income communities, they are directly linked to the hydrosocial cycle. And by sabotaging these sort of knowledge cycles from participating in decision-making, you're obstructing their health or their access to health. By hydropolitan urbanization, I mean that this is a process that describes how low-income urbanism runs along these hydrosocial lines and includes or excludes specific groups of people to access the city through different water accessibility. So this you can see if you compare the price of water in Victoria Island, one of the most affluent neighborhoods in Lagos, with the cost of water in Makoko, where insanely in Victoria Island, it's cheaper relatively than in Makoko. Hybridity here is defined as internally related rather than dichotomous or binary between formal and informal. So what I mean with this term of hybridity, which is different to Charisma Ace's term of hybridity, is that you cannot separate the formal and the informal because it is within each product, these sort of distinct processes. The socio-material porosity is what we've seen in the pipes that run along the water, where you have sort of a porosity between who gets ill and how it's related to their spatial location. And then finally, what I've described already are these epistemic determinants of health, where known and unknown knowledge systems and epistemic inequalities or barriers predetermine the hydrosocial cycle. So, for example, narratives of informality prevent community knowledge and collaborations to permeate formal spheres of influence, such as government, resulting in these archipelagos of health infrastructures and the vast in-betweens where people get sick because of the infrastructures that they're exposed to, while also coming up with sort of solutions to the lack of government-sponsored infrastructure. So that was it from my side. Thank you very much for listening, and I'm happy to get questions. And if Gowon is still here, yes, he's still here. We can both take questions.
Okay, I think is Julia going to, Julia, you're going to be the moderator, are you?
Yes.
Questions and answers. So, but a short thank you to Nura for this really illuminating, illuminating discussion on water and its ways and the ways in which it permeates different parts of different sectors of society in Lagos, and particularly the Makoko situation, which is very, very recent. It's just over Christmas.